Hello and welcome to Beyond Thriving, where we take a deeper dive into our Thriver Thursday episodes. I'm Gabriel Kerr.
And I'm Jade Anderson. Today we'll be discussing a rare form of cancer called Ewing's sarcoma and how to thrive after a diagnosis. We're joined by Dr. Paul Myers, a pediatric oncologist and specialist in Ewing's sarcoma, Dr. Trevor Bayless, an oncologist and cancer survivor, Dianna Austin, a cancer survivor, and her brother, Christopher Shattuck, who's currently going through treatment. Thank you all for joining us today. Dr. Paul, I want to start with you. We just watched our thriver, Mark Herzlich's amazing journey and story. Can you start by explaining what Ewing's sarcoma is?
Ewing's sarcoma is a very rare cancer. There's about 350 cases a year in the entire United States of America, which makes it literally that 1 in a million. The word sarcoma means a tumor that's arising from the mesoderm, what doctors call the middle tissues, the bones, the muscles, the joints. And it's completely different from carcinomas, which arise in the epithelial tissues, the tissues in contact with the outside world, like lung carcinoma or skin carcinoma. It requires intensive chemotherapy and surgery or radiation therapy to deal with the primary tumor.
With Mark's story, he talked about how the doctors first told him all he would be able to do is walk with a cane for the rest of his life. And as an athlete, that's like the worst thing you could ever hear. So he wanted to go to other places to find someone else who could help him find a different answer.
Well, there's so much more that goes into it and supporting that and supporting that patient. And so the integrative therapies in my mind are hugely important to that. And when we look at this, we think of sort of a three-legged stool in this regard with some type of physical activity. Mm-hmm. Obviously, for our thriver, that was easy to generate. And some of our older folks, it might just be getting out of the chair a few times a day. You know, so everyone's starting at a different level. But physical activity, a nutrition plan, and some type of mind-body approach, some type of mind-body support. I think is hugely important.
Having been on both sides as a doctor and a patient, how important is that relationship, the doctor-patient relationship?
It's hugely important. I was diagnosed. I was told I had a very indolent, slow-moving disease, and I did well for a year, continued with college. And then I started getting really sick, really winded. I found out that the leukemia had infiltrated my lungs, infiltrated my liver. It wasn't long before I was on oxygen. I was doing chemotherapy, and I was supposed to have a bone marrow stem cell transplant, about a week away from the scheduled transplant. And the doctors called a meeting. The doctor comes in and sits as far across the room as she basically could from me. And she proceeds to tell me that I'm not responding. I would probably die from the transplant. We don't have anything else. You may have months, maybe weeks. Wow. I remember actually the first thought I ever had of becoming an oncologist was on the plane ride home, oxygen in my nose, 30,000 feet in the air, thinking I could have done that better than that doctor did. And God, if there's some miracle that happens, I think I can do that. I got home and that specialist said, hey, there's some patients responding to this low dose weekly pill, old drug, methotrexate. It might be worth a try. And I tried that, and the rest is history, as they say. But being able to get on the other side and being a physician and realizing how difficult it is to do that. To go into a room and have to tell a 20-year-old, we don't have anything else for you. It's incredibly difficult, but you have to open your heart when you do it. But it's so important to build that, to have that connection, to have that trust, to be able to sit down and shed a tear with the person, to put your hand on their shoulder.
Dianna, I would like to turn to you. You are a breast cancer survivor and thriver, and I'd like to know, in your opinion, what do you think was the biggest factor towards your recovery?
A number of things, actually. Definitely the support of my family and friends. I had a wonderful care team at the hospital where I was being treated. And I was able to take advantage of integrative therapies as well. During my chemo, for example, I would get acupuncture, and I credit that for helping me to stay calm. I didn't have the nausea that they were expecting me to have based on the chemo cocktail that they were infusing, into my system, I got such great results from yoga, and meditation is also something that I continue to practice.
Now, Chris, you are currently going through cancer treatment, and you credit support groups with helping you.
I get support from my family and my friends, particularly my friends in AA, because I'm dealing with 2 diseases at once. And on my bad days, I talk about both in the meetings, and that helps me. And when they see that I'm having a bad day from the side effects, they'll lift my spirits. Veterans, we don't talk about anything. We hold it in, but hopefully my story will get other veterans out there to open up. It's like, it's okay. If don't hold it in, if you're suffering, if you're dealing with PTSD and then you have this, you're compounding things and you're making it worse. So, I talk to Dianna or some friends, open up about it, be positive and talk. That will get you through, and it has. 10 years sober, so even through all this, I'm still sober and I'm grateful.
And Dianna, I'm so excited to talk about your company, Coils to Locks. It's centered around providing natural wigs to women of color. Why was that so important for you to create?
Well, as a cancer patient, when I learned that I was going to lose all of my kinky, coily hair due to chemotherapy, and I was given a wig prescription, my thought was I wanted to look as much like myself as possible. Sure. And so when I was armed with this wig prescription and I went to every cancer center boutique in the area where I lived in Boston and couldn't find these wigs, it was very frustrating for me. I did research actually across the country at major cancer center hospitals that had these boutiques, and none of them carried coily, curly wigs that look like my hair. Unfortunately, hospitals aren't treating all of their patients the same. They're not providing the same access to care, or in this case, product. That was the impetus to starting Coils to Locks.
I think that's the definition of a thriver, who comes out of their experience motivated to make a change and to help others who are doing it too.
Absolutely.
Yeah.
It's fantastic.
Yeah.
Absolutely
Now, in
fantastic.
Mark's episode, he told us that it's not only an individual that goes through cancer, it's an entire family. Mm-hmm. And for you both, as brother and sister, you're going through it twice. How important has it been for you both to have each other to lean on?
For me, it's been very important because Dianna survived it and I'm still going through it. If I have a bad day, I'll give her a ring, and vice versa. So we lean on each other for various things, and it has gotten me through this past year.
It was incredible. It's so important to your healing, in even your ability to just get through treatment, to be able to have this type of support. So I feel really fortunate in that regard.
Yeah. Doctors, I want to ask you, there's so much promising news in terms of research. What are you guys most excited about?
Oh, it's an incredibly exciting time. The 2 areas I think that are most exciting are what's called precision oncology, which is understanding the exact genetic defect that leads a healthy cell to turn into a cancer cell, and sometimes leads us to identify a vulnerability, a chink in the armor that we can use to attack that cancer. And the other, of course, is immunotherapy, which has been huge. So yes, they're dramatic, they're incredible, they're breakthroughs, they're absolutely breakthroughs, but they have to be given with great care.
What's a simple way to educate someone on cancer and also that you can thrive after cancer?
I think it's about offering options. There's a tremendous number of resources available on the internet. There are support groups. We have a chat group for our adolescent and young adults, which they tell me is quite active. I'm not allowed on it. And we always ask, would you like to talk to someone who had your condition, your exact same condition, at about the same age? Would it help you to talk to someone who went through this and is thriving?
Thank you to our guests for joining us today. Please be sure to share your comments with us below.
And for resources on where you can find support for cancer, visit our resources tab on thriverthursday.com. Thank you for watching Beyond Thriving.